So today I'll be presenting my capstone project, The Effectiveness of Diabetes Interventions Programs. As for the preliminary sections, it will be divided up to different sections that include abstract, the dedication, list of tables, the main body of text, which includes introduction, materials and methods, results, discussion, conclusion, and references. Diabetes mellitus is a chronic condition that has posed as a significant public health challenge worldwide, especially in the United States. This capstone paper evaluates the effectiveness of various diabetes intervention programs that are designed to reduce the prevalence and associated complications with the disease. The study examines community-based interventions, lifestyle modifications, and behavioral intervention programs, which analyzes and evaluates their clinical outcomes and overall health outcomes as well. Evidence from a comparative analysis and common themes demonstrated in these interventions will determine which intervention is best suited for future implementation. Overall, each intervention provides their pros and their cons, but there needs to be a combination of these interventions to provide the best results from the population. Furthermore, interventions that implement culturally tailored interventions and accessibility can demonstrate an enhanced engagement and adherence among communities. Also, technologically driven solutions such as mobile tracking tools or mobile centers can show promise in improving patient monitoring and motivate self-management strategies. But barriers such as socioeconomic factors, limitations in healthcare access, and patient motivation continue to be a challenge in optimal program effectiveness. This capstone is dedicated to my wonderful family, whose unwavering support and encouragement has been the greatest motivation for my strength throughout this journey. To my parents, thank you for instilling in me the values of perseverance and compassion. Your guidance and sacrifices have shaped the person I am today, and I hope to continue to have an impact in the world of public health. This work not only represents my academic growth and completion of my degree, but reflects my dedication to my career. I could not have done this without you. I am forever indebted to you. Throughout this capstone, there is a total of 3 different tables that will be presented later on. Now I'll be discussing the background information for this capstone. Diabetes is a major public health concern in the United States and has been affecting over 38 million people, causing major upsets in the public health community. This chronic condition is associated with other conditions such as cardiovascular disease, kidney disease, and etc. that has had an impact on quality of life as well as economic burdens on the healthcare system. In 2023 year alone, the economic cost of diabetes was around $412 billion and includes direct medical costs and indirect costs as well. With these major impacts on society, it was imperative for public health agencies to develop effective diabetes intervention programs, which often include lifestyle modification, education, social support groups, and medication adherence components, which are all designed to help individuals with their chronic conditions. These programs are created to target both clinical outcomes such as lowering cholesterol and HbA1c levels, and also behavioral changes like eating nutritional foods and exercising. But despite the increased availability of such programs and community resources, the prevalence of diabetes continues to rise and continues to be a major public health concern for the United States and is a leading cause of death. Over the years, there have been numerous diabetes intervention programs that have been implemented to address this rising public health concern. These programs range, as mentioned before, from lifestyle interventions to medication adherence to clinical care-focused tools that incorporate patient education, medical management, and behavioral changes. There have been multiple studies from NIH or from the American Diabetes Association that still recognizes diabetes as a significant health issue in today's world, and it continues to grow amongst the USA population. It is the duty of public health officials to further research to determine which strategy yield the most sustainable outcomes, and which will be supported by this project to build on existing knowledge by evaluating these different intervention programs and improving health outcomes and reduce disease prevalence. With the increasing number of individuals diagnosed with diabetes, even spreading to younger age groups, it necessitates a deeper understanding of the overall effectiveness of the intervention programs and which are the most effective in mitigating these burdens. Exploring the effectiveness of diabetes intervention programs is significant for several reasons, which includes addressing the diabetes epidemic, reducing health complications and overall cost, motivating behavioral change, and having an overall societal impact. but many programs vary widely in their structure, measures, and outcomes, and their overall focus when it comes to diabetes management. Identifying the most impactful strategies will aid in slowing the disease's presence, improve population health, enhance positive behavioral habits, and reduce its long term health consequences on the population. Alongside identifying these strategies, it will also be significant to guide the design of future interventions that will support long term disease management and implementing physical activity and adopting a healthy nutritional diet into society. With evaluating the effectiveness of diabetes intervention programs, this research will have the potential to enhance the development of more effective and sustainable intervention programs. All of this information brings us back to the purpose of this capstone, which is to evaluate the effectiveness of current diabetes intervention programs in the United States and determine if it has improved health outcomes and what successes and limitations have presented in these programs. The project will examine both the clinical outcomes and behavioral changes of the population and provide evidence-based recommendations for strengthening the program design and its implementation. To continue with the literature review, in the continuation of the prevalence of diabetes, intervention programs have been developed to improve disease management, promote healthy habits, and enhance overall quality of life. These programs can range again from educational initiatives to lifestyle interventions or to even medication usage, aiming to empower individuals to reduce their glycemic control, increase physical activity, and diabetes-associated chronic diseases. Overall, their effectiveness varies based on factors such as the type of intervention used, patient engagement, accessibility, cost effectiveness, and many other factors that may have not even been identified. This literature review will explore existing research on the current diabetes intervention programs while analyzing their impact on health outcomes, behavioral changes, and the sustainability of these programs. By evaluating the different measures and their effectiveness, this review aims to identify the best practices, areas for improvement, and bridge gaps in diabetes medical care strategies and disease prevention. So again, these intervention programs vary widely in their approach by targeting behavioral, medical, and even technological aspects of disease management and prevention, but they have an overall goal to improve disease management, reduce complications, and prevent the onset of diabetes among the population. An example of a current lifestyle modification program is the National Diabetes Prevention Program, or DPP, which is a partnership between public and private organizations which effectively reduces the risk of developing diabetes by promoting healthy lifestyle changes. Only after 4 years, this program showed that participants lowered their chances of developing type 2 diabetes by at least 58%. There's also the Diabetes Self-Management Education Support, or the DSMES program, which has demonstrated improvements in glycemic control and overall improvement of quality of life for individuals with diabetes. This measure utilizes psychological techniques such as goal setting or motivational interviewing, which helps individuals with diabetes to make sustainable lifestyle changes for the duration of their lives. Of course, there are other more localized resources available, such as community-based strategies, which are aimed at making smaller, meaningful impacts on the community itself. Each strategy offers unique benefits and challenges, and a combination of them may offer a great approach to the prevention of diabetes and its control, but there needs to be a definite answer to choose which of these methods proves to be the most effective and should be prioritized over the others. As for their effectiveness, it needs to be measured by changes in glycemic markers, HbA1c and sugar levels, weight loss, BMI, and incidence reduction, and evaluate their sustainability. While the diverse types of intervention programs mentioned are aimed at improving these clinical outcomes, their long-term sustainability varies depending on their structure, participant adherence, and accessibility, as well as other factors that may play a key role that we have not considered yet. It is said that one of the most effective strategies is lifestyle modification programs, and the most well-known is the DPP, which demonstrates the intensive lifestyle intervention, reducing the risk of developing disease by at least 58%. But with these positive benefits, we must look at the overall population of the USA because unfortunately diabetes continues to be a health concern and something is being overlooked or not evaluated enough to be able to understand this issue. Besides the internal design of these programs and supposedly to be the most effective strategy, why is diabetes still a problem? Should we consider other methods of strategy or external factors such as accessibility, cost effectiveness, etc.? Another strategy that is commonly used for diabetes prevention is community-based interventions, which can include diabetes self-management, education, and support, or known as DSMES programs, which have been effective in improving diabetes outcomes. These types of interventions are particularly great in underserved populations due to their inexpensive yet effective strategies in providing resources to the community. For example, an analysis of these programs displays participants lost an average of 4 pounds and have the potential to reduce diabetes and morbidity for low-income populations. There are also peer-led interventions that have also been successful in diabetes management and has had favorable effects on improving glycemic control, increased physical activity, and positive participation adherence. While these programs have great benefits and flexibility, there are also some challenges alongside them, which include funding limitations, scalability issues, and even social determinants of health, which all create barriers to implement effective community-based interventions. For diabetes intervention programs, participants have tried to lose their body weight and maintain that weight loss, positive behavioral changes, and improve risk factors for diabetes-related diseases. Not only are these great behavioral and clinical changes, but it also has impactful psychological changes in the participants as well. Health officials believe that regardless of meal planning or dietary habits, it is important to optimize self-efficacy and maintain these lifestyle changes. This is something that is severely lacking in the care for diabetes and its long-term management. In other studies, it supports that higher A1C levels can also negatively impact on a person's self-efficacy, personal confidence, and lead to less optimal eating and exercise behaviors. Despite the research supporting the effectiveness of diabetes intervention programs in preventing and managing diabetes, there are still barriers that are limiting their potential impact on the population. These barriers can exist at multiple levels, which include adherence, healthcare system concerns, and socioeconomic and structural barriers. It is imperative for public health officials and healthcare organizations to understand these challenges are key to improving program accessibility and long-term sustainability. One of the most significant challenges is the long-term adherence and sustainability of the lifestyle modifications. It seems that many struggle to maintain the dietary habits, physical activity, and overall behavioral changes that are necessary for diabetes management. As for the DPP, over time, patients regained weight and returned to old habits after completing the programs, so it does reduce the long-term longevity of these programs. There are also barriers concerning the healthcare system and how these programs can be a financial burden, especially for uninsured or underinsured populations. It's also been proven that despite cost effectiveness of DPP programs, upfront costs remain high, leading to low participation rates among at-risk populations. There's also the concern of socioeconomic factors and disparities, but these factors do play a significant role in an individual's ability to participate in and benefit from these programs. There are also environmental factors that play a huge role, which include food deserts, affordability, and the general cost of wellness programs as well. Even many healthcare providers are unaware of structured diabetes prevention programs, and they lack the availability of resources for them to refer their patients to. This all leads to a study that indicates that only 28% of primary care providers were aware of the CDC lifestyle programs, and only 19% were aware of STAT toolkits. There's also been a severe lack of evaluation about DPP or other intervention programs, and that it seems that there's no rush to evaluate these programs and continue to make improvements in their prevention efforts. The methodology for evaluating the effectiveness of diabetes intervention programs will include both quantitative and qualitative approaches to fully understand the specific aims outlined above. Also, while only reviewing case studies, literature reviews, and peer-reviewed articles, it is imperative for the knowledge being obtained to only come from these types of articles to have accurate and reliable data. Clinical data collection will also be utilized to obtain and compare data from previous studies, revealing the results of current diabetes intervention programs and comparing the key health indicators such as HbA1c, BMI, and diabetes-related complications. It would also be useful to complete a comparative analysis to outline these variables, which will be useful in this project by providing evidence on which factors of these programs are causing limitations for individuals to adhere to the changes. By combining these methods, it will yield an overall comprehensive understanding of how the current diabetes intervention programs are or are not improving health outcomes and create a functional solution to combat the diabetes epidemic. So this is table 1 with the comparative analysis results that was done between the 3 main intervention styles: the lifestyle modification, behavioral, and community-based intervention, and we will discuss this more in the next slide. The intervention programs that are analyzed include a lifestyle modification intervention, behavioral intervention, and a community-based intervention. As shown in Table 1, these are the main 3 studies that are being analyzed and represent different criteria for each of these interviews. Each type of intervention presents findings on their effectiveness, sustainability, accessibility, their impact on targeted populations, but also the likelihood of which interventions can be used for universal diabetes care management. Each study also had a target population they were aiming to create specific interventions for, and the analysis demonstrates the key components that were used to combat the impact of diabetes. The lifestyle modification study presented much clinical outcomes and improved in HbA1c levels and improved overall health outcomes in the participants, while the behavioral intervention program also had great overall health outcomes and helps in improving self-efficacy and higher self-esteem in the participants. But as for community-based interventions, they provide great promise for not only their effectiveness on individuals with diabetes, but also their social impact on communities in general. Now, this is Table 2, and it contains the challenges and recommendations that was brought upon from the evaluation and analysis. According to Table 2, it provides more in-depth evaluation of the 3 intervention programs and contains sections such as challenges, limitations, and recommendations to increase their overall effectiveness. For lifestyle modifications, they face challenges such as the increase in hypoglycemic episodes, frailty, and a lower engagement with the Hispanic population. As for limitations, it includes possible transportation issues for older adults, aggravation of other chronic conditions that older adults may have, and they also may have cognitive issues as well. And for recommendations, they include emphasizing the importance of social emotional support, implementing longer follow-up periods, and standardizing intervention protocols. For behavioral interventions, it encounters challenges such as lack of contact with others who have diabetes, limited opportunities to reinforce self-management strategies, and difficulty following recommended behaviors as well. Some challenges with this type of intervention include the absence of information on socioeconomic status, variability in responses and results, lack of follow-up support, and has no recorded sustainability outcomes. Recommendations for this type of program are understanding why people did not return for their follow-ups, promote collaborative goal setting in group settings, and tailoring interventions to individual clinical and social needs. Now finally, with community-based interventions, this specific study suffered greatly during the COVID-19 pandemic, which hindered its service delivery and community engagement, and in general cannot track the participants' progression. Other limitations include no knowledge of long-term health changes, limited reach and coverage, and possible resource constraints. And recommendations for this may include developing an interactive tracking tool for glucose levels and food intake, implementing community support features, creating secure platforms for data sharing with local healthcare providers, and increasing funding and resources to expand these mobile centers. So this Table 3 shows the common themes that we're seeing throughout all these programs. It is important to identify the common themes that each of these interventions face and understand their overall impact on the program's effectiveness. Common themes that were seen in at least 2 of the interventions were participation adherence, accessibility, and sustained support. Low adherence rates, which caused by the inconsistent follow-ups or activity in the strategies, reduce patient engagement and leads to incomplete interventions. For accessibility, it presented challenges for diverse populations, which results in further health disparities and results in unequal outcomes and limits the program's overall reach. Additionally, a lack of sustained support was seen commonly in all 3 of these interventions, which undermines the participants' ability to maintain long-term behavior changes and increases the likelihood for relapse into unhealthy habits. Overall, these factors reduce each program's ability to achieve lasting impact and highlights the need for tailored strategies to promote engagement, and thorough recommendations will be discussed to address these issues. Now we'll be discussing more in-depth into these 3 different tables for these 3 different intervention programs. The original research question was to evaluate whether the current diabetes intervention programs are improving health outcomes and what key factors contribute to the success and failure of these programs. Lifestyle modifications mainly focus on diet and physical activity and has shown significant impact on weight loss and glycemic control, while behavioral interventions, which had emphasized on psychological strategies, have shown moderate success in improving adherence to healthy habits and even reduces stress-related factors because of the more individualized practice. As for community-based interventions, which has leveraged social support and environmental changes, have yielded great improvements in overall diabetes awareness and engagement, especially in diverse populations. The significance of these findings lie in their implications and potentiality for public health policy and program evaluation. The scope of research is focused on the impact of these intervention programs on health outcomes and evaluating each of their own models. As for limitations of research, while there have been valuable insights, even with evidence to support to evaluate and redesign programs, political and economic interests may prevent appropriate implementation. The research suggests that the diabetes intervention programs can be highly impactful in preventing type 2 diabetes, but their sustainability and accessibility and long-term success depends greatly on factors such as socioeconomic statuses, participation adherence, funding, etc. The research aligns with trends in healthcare disparities, unfortunately, where lower-income individual minorities face barriers to accessing the necessary resources and services. This research builds upon previous studies that have examined the effectiveness of these programs, identifying gaps in the overall public health impact of prevention and reduction. But this study, within the broader aspect of research, strengthens the existing knowledge, but also advocates for further policy changes to intensify the need for accessibility and long-term sustainability of diabetes intervention programs. With Table 2, it provides significant information that is crucial for program evaluation and how barriers impede success and can lead to solutions to improve outcomes and have a countrywide impact. The challenges section reveals each intervention type facing their unique obstacles, such as lack of electronic tracking, lower population of diverse individuals, increase in hypoglycemic episodes, or even external disruptions such as the COVID-19 pandemic. As for the limitation sections, it emphasizes that gaps in sustainability, follow-up support, accountability, and equitable healthcare access to interventions and resources. But there was an interesting unexpected finding from this analysis, which was that many of these programs, especially among lifestyle modification and behavioral programs, did not have a focus on diverse populations, nor a mention of SES factors. It does reveal a critical gap in healthcare equity, and it's concerning to see how these programs are leaving out a major population of individuals that suffer from this disease. This discussion is significant for diabetes intervention effectiveness as it provides perspective into the real-world application of these programs. The recommendations from Table 2 present to be significant because they address the key barriers that limit the effectiveness of diabetes intervention programs. By increasing social and emotional support, individualized behavioral strategies, and the usage of digital tools, these recommendations may provide a guide in making these programs more inclusive and accessible, and more importantly, sustainable. Addressing the challenges mentioned in Table 2, it will help in ensuring participant progress and that interventions are more effective in managing diabetes and improving population health overall. One of the main implementation strategies is to enhance accessibility for all of these intervention programs. The programs are designed with not only linguistic considerations, but cultural considerations in mind, ensuring that materials and resources are available in multiple languages and tailoring to the needs of the diverse populations. Another main implementation strategy is to standardize and lengthen follow-up support in order to ensure participation in individuals' care plan and hold them accountable to, ultimately, improve their health outcomes. And now, of course, another final implementation strategy that can help spread awareness of diabetes, such as education, management, resources, healthcare services, etc., is to expand community resources. Of course, with extra funding from government agencies, it could also be allocated to community health organizations and health centers to increase coverage and sustainability. Partnering and creating relationships with local organizations, employers, hospitals can help to integrate prevention and management into community settings. So by implementing these implementation strategies, these programs can help to become more effective, reaching all populations and ensuring the success long-term health improvements and reduction in diabetes prevalence in the United States. So addressing these barriers and analyzing what type of recommendations can be utilized, such as increased usage of community-based interventions, increase in program evaluation, and increased focus on cultural awareness, it can enhance the long-term success of these program efforts. With these themes, it highlights the critical areas where these interventions fall short and can allow public health professionals to develop targeted strategies for improvement in effectiveness, recognizing that participation adherence is a major key component between these interventions. Acknowledging them can help in the designing strategies to improve retention. Long-term adherence is crucial as well for behavioral changes, dietary habits, and diabetes management to improve in individuals with diabetes. Identifying the underlying struggle to maintain participant involvement allows for these programs to implement their own solution and be able to provide the resources for participants to be able to adhere. Future research and evaluation must focus on the sustainability of these programs and their impact on diverse populations to ensure not only equitable healthcare, but accessible healthcare as well. And of course, recognizing these themes is the first step for researchers, public health professionals, and healthcare providers to refine diabetes intervention, making them overall inclusive and sustainable to reduce the presence of diabetes in the population. So, in conclusion, this capstone highlights that while lifestyle modification, behavior support, and community based interventions offer significant positive results for diabetes management, but it still contains challenges such as limited accessibility, lack of follow up support, etc., that present to hinder their success. It is essential that diabetes intervention programs to prioritize inclusivity, ensure that diverse populations become a focus for them to be able to access resources and healthcare services. There's also the unanswered question that was not addressed, which was, should diabetes intervention programs be more widely covered by insurance and government programs? It directly addresses the public health policy and long-term cost effectiveness of these programs. Ultimately, current diabetes programs are providing good results, but it is not sufficient, and we must create comprehensive and personalized approaches to improve population health outcomes, reduce healthcare disparities, and utilize program evaluation to create a more effective public health response to this diabetes epidemic. And these are all the references that were utilized for this capstone.